So this is my passion, preventing diabetes. And the way to know how to prevent it is to know how it's caused, what diabetes is, and what we can do to stop it in its tracks. So, and there will be a opportunity to ask questions at the end, but you're also very welcome to interrupt me at any time. I want this to be really informal. And if you can't hear me, just let me know. Okay. All right. So the talk is going to cover what diabetes is, how it develops over a long stretch of time, and that's why we can prevent it. It really develops over about a 10-year span. What you can do to prevent diabetes, and then we'll talk a little bit about whether you personally are at risk, and then I'll just summarize and give you an opportunity to ask questions. So as you, I'm sure, all know, diabetes is a disease of sugar, right? Okay. So when you eat starchy foods or carbohydrates, oops, I've got a little thing here, I don't have to step in front of it, your body's digestive system converts that into glucose, okay? Glucose is the main energy molecule of the body. It's what allows you to do everything what we do. So insulin is produced by the pancreas, this little squiggle. Okay, this is the pancreas. It's located here in your belly, just kind of off to the left side, tucked in your small intestine. It is made up of a bunch of cells, and there are little nests of cells called islets. And the islets produce insulin. That's these pancreatic acini or islets. Okay? And it'll become apparent why I'm bothering to tell you all this stuff. Okay. So I'm sorry, this is a little bit fuzzy, this slide, but this is the way insulin works. And again, it's important to understand this stuff in order to understand what diabetes is. Okay? So insulin is kind of like a key that fits into this lock. Okay? These little blobs here are cells of your body. Okay? The insulin fits into that lock here, and it opens the channel which allows the sugar to go into the cell. Okay, so once the insulin's attached here to that lock, the key is in the lock, this channel opens and sugar is able to go into the cell. So what is diabetes? There's two types of diabetes, and they're really very different from each other. Okay? Type 1 diabetes, which is not going to be the major focus of this talk, but I'll just speak briefly about it. Type 1 diabetes is caused by destruction of the pancreas, of the cells of the pancreas. Okay? So these are those acini or the islets. They get destroyed. Okay? And there isn't enough insulin, so the sugar is not able to go into the cell. Okay? And I'll talk a little bit more about type 1 diabetes in the next slide. Type 2 diabetes, on the other hand, is very, very different. What happens is there is plenty of insulin, but the cell, it's not working right. And I'll explain that in a minute. Okay, so this is just a little bit more about type 1 diabetes. The immune system destroys the pancreas, and it is no longer able to produce enough insulin. It's caused primarily by genetics, but people don't really understand that well what causes type 1 diabetes. We think it may be related to a viral exposure. There may be other toxic exposures that causes it. It almost always starts in childhood, and it's usually a pretty dramatic onset. People get really sick, and you know they're sick. Okay, the way you make the diagnosis is by blood tests, checking your sugar, and the treatment is primarily replacing the insulin that the body doesn't make. Okay, although diet and exercise are also a really important part in type 1 diabetes. So this is just a slide, and again, I got these off the web. They're a little fuzzy. Sorry about that. But this is a normal pancreatic islet, and this is one that's been destroyed by the immune system, looking under the microscope. Any questions about type 1 diabetes before we move on to type 2? All right, so type 2 diabetes, and again, this is where it starts with the insulin resistance, where insulin isn't working right. It also is caused by genetics, but it's primarily, or to a large extent, a lifestyle problem, okay? Obesity is very strongly associated with diabetes, and I'll explain more about that also. And then just being physically inactive. Big problems across the world now. And type 2 diabetes, because of the increase in obesity and inactivity, is rising really quickly. Who gets it? It generally occurs as in adults. It rarely occurs in children, although you've probably heard in the news that obese teenagers are starting to get it, but really that's a very small percentage of people with diabetes type 2, okay? There are some ethnic differences. African Americans, Hispanic, Native Americans, and Asians tend to be a little bit more prone to diabetes than Caucasians, white people. And the diagnosis is made basically the same way by a blood test. And I put in big, bold, that's the whole main gist of this. Okay, the way to, this is once you have diabetes, but it's the same idea, okay? Exercise and diet and weight loss are really key, really, really key. Okay, there are also pills and injectable drugs, including insulin. There's some newer drugs that are also injectable. All right, moving on. So this is just a little bit more about the way diabetes type, so now the rest of the talk is going to be about type 2 diabetes only, okay? Type 2 diabetes, the first thing that happens in type 2 diabetes is insulin resistance, okay? So the cells just don't listen to the insulin that your body is making. So this is a different from the one I showed you before because it's a little bit more accurate. So if these little purple triangles are the insulin, these little hexagons are the glucose, what's happening is the insulin does attach itself to those, so like the key in the lock, these things called receptors, okay? But it doesn't open the sugar channel properly, okay? And so that the glucose is trapped on the outside. This is not an all or nothing thing, it's just, it's a question of degrees, okay? So it doesn't work, and over time it gets worse and worse, all right? And so, so this is called insulin resistance. That's a really important concept. Does everybody understand what insulin resistance is? Yeah? Okay. All right. And then what happens over time, and this is way after you've had diabetes for a long time, especially if your sugar has not been controlled, is what's called beta cell dysfunction. So beta cells are the cells that make insulin. They live in the pancreas and they make insulin. And over time, those cells start to die. The pancreas starts getting messed up by the high sugars. And this is a very complicated slide and very scientific and all this stuff. There's a lot of theories about why the beta cells start dying off. But once that happens, you start looking more like a type 1 diabetic because your body's actually, the pancreas is actually not making enough insulin anymore. All right, so this is kind of a summary of the changes over time. And the thing I really want you to, the take-home message is, the journey from a normal insulin, normal sugar, normal metabolism and all that good stuff to actually getting the diagnosis of type 2 diabetes, that's 10 years for most people. That's a lot of time to figure out that you need to do something differently to prevent yourself from getting diabetes. And to me, that's great news. This is really positive because it means that we really can prevent diabetes, okay? So, but this is just kind of a summary. I don't know how much you guys like graphs, but so as you can see, the red line is insulin resistance, like we talked about just a moment ago, okay? So the first thing that happens is the body starts becoming insulin resistant, okay? And in the beginning, the pancreas pumps out more insulin in order to make up for the insulin not working right, okay? But over time, the pancreas gets worn out. See the beta cell dysfunction, what we were just talking about? So this is what your doctors are checking, okay? This is your sugar level in your blood, okay? As you can see, for a while, you're able to keep your blood sugar normal by making more insulin, okay? But over time, that sugar level starts creeping up, okay? As your pancreas is no longer working right and can't keep up with the amount of insulin it needs to make, your sugar starts rising. This part right here is impaired glucose tolerance. Another name for it is prediabetes, exactly the same thing, just two names for the same phenomenon, okay? It's right in here before you get this severe decline in your pancreatic function. That's where you can do something. A lot of people ask, is it possible to get rid of diabetes? And the answer is, good question. The medical establishment has not yet said, yes, you can get rid of diabetes, but in fact, you really kind of can. So you will always have the tendency to develop diabetes, so you always have to be careful for the rest of your life, but you can actually get your hemoglobin A1C level down into the normal range with diet and exercise. Pretty cool. And we're going to talk a lot more about that in a minute. All right. So, and this is what you were asking. So, okay, so The main way to prevent diabetes is improving insulin sensitivity. Remember, there's two things, insulin sensitivity and the pancreatic function, okay? But the main thing is you want to catch it early. You want to improve insulin sensitivity before the pancreas starts getting damaged, okay? So there's a bunch of things we can't do anything about. As you get older, you increase your insulin insensitivity increases, your sensitivity decreases. We talked already about certain ethnicities that have a higher risk of developing diabetes, and then genetics, family history, okay? We'll put those aside because we can't do anything about them. What we can do things about is these things, and it's what I've been alluding to, okay? Physical inactivity we know makes insulin work less well. Obesity, being overweight, makes it work less well. Eating a poor diet, not just contributes to being overweight, but it also, there are certain foods that seem to be worse, so seem to worsen insulin sensitivity. And then there's certain medicines too, that particularly the antipsychotics medicines and some other medicines that can actually worsen your insulin sensitivity. So if you're kind of tipping that way, you might want to ask your doctor, is there any medicine that could potentially cause problems with my sugar? So obesity, that's the biggest one. I mean, and I think everybody has probably read in the papers, the curve for diabetes over time, it's just going up, 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 okay? And we think, and it seems to be going up in concert with the obesity epidemic. The good news is that obesity is finally leveling off, and we're actually starting to see a leveling off of the incidence of diabetes, meaning new cases of diabetes. So obesity is number one, okay? And this is just a graph that shows this, that BMI is body mass index. Body mass index is defined as your weight divided by your height squared. It's just a way of measuring body fatness, okay? It's not perfect, but it's pretty good. It's a pretty good measure of body fatness, and it's easy to do because we always check weight and height. So a little bit more, again, the second slide on improving insulin sensitivity, so obviously losing weight, okay? There have been multiple trials, both internationally and in the United States, showing that small amounts of weight loss markedly decrease the likelihood of getting diabetes in people who are in that pre-diabetic range, okay? That's the good news, and that's the main focus of this talk, okay? It works. It really works. And this is not a lot of weight, okay? 5 to 7% of your body weight, if you're overweight, can cut your risk of developing diabetes by 58%. That's so much better than any drug we have. Everybody, all the people in public health were just jumping up and down. It's like, yes, we did better than a drug. Okay, it really works. And in people over 65, which is most of the diabetics, that number is 70%. 70% decreased likelihood of developing diabetes if you lose 5 to 10% of your body weight, not a lot. Okay, so what does that mean, 5 to 10% of your body weight? If you're 200 pounds, and we know there's a whole bunch of people that weigh 200 pounds or more, okay, you only have to lose 10 to 14 pounds. We're not asking you to get skinny, we're asking you to just lose a little bit of weight. And I should add, actually, it's not just weight, but it's also maintaining an active lifestyle. And I'll talk a little bit more about that as well. All right, so remember, if you remember nothing else, remember this slide. I think I've said that before. Okay. And why does that work? It's because we know that losing weight increases your insulin sensitivity. So it's related to the other slide I said, don't forget that slide. Okay. Any questions about that? All right, so this was the diabetes prevention trial. It came out in 2002. And I'll talk a little bit more about what's come since then. Okay, and like I said, it's not just weight loss, but it's also exercise, and obviously they're related to each other. But this is the risk of, on this scale is the risk of developing diabetes, and this is a measurement of how much exercise you do, and you can see it's directly correlated. Okay, the more exercise you do, the less likely you are going to develop diabetes. In this case, 1 means 100% chance of getting diabetes. And so this is, I encourage you all to go online and look this up. This is the last time that they'll probably redo this sometime in the not too distant future because there's been a lot of research about exercise. But this is from the United States Health and Human Services Department and a number of other organizations that are interested in exercise. The last one was in 2008. And this is the key guidelines. I simplified them. It's actually a big document, but basically, don't be inactive. So we know that actually just sitting, even if you exercise for an hour a day, sitting is bad for you, okay? So people who go run for an hour and then sit at their desk for the rest of the day, there is some increased risk of diabetes and other health problems. So if you are sitting at your desk a lot, or sitting doing crafts, or whatever you're doing sitting down, get up, move around, every half hour or an hour, just get up and walk around a little bit, do a few jumping jacks or whatever, just move. For people who sit at desks, there's actually now, they're coming up with these great devices. You can get a pedaler that you put under your desk. It's just like a little stationary bicycle that you just put under your desk and cycle while you're doing it. I don't know if our productivity will go down or up. I think it might go up, actually. And there's also walking desks that you can buy. They're not cheap. So anyway, avoiding the inactivity. Don't sit around a lot. It's really bad for you. And don't watch TV a lot. That's how most people sit very, very still, because it's very entertaining and you don't want to move because you want to catch every word of it. So TV is a big part of inactivity. And then the other main guideline is do at least 150 minutes of moderate intensity. It's actually moderate exercise. You can also do it vigorous, but I think for most of us, we don't really work out really, really hard. But it's actually 150 minutes of moderate to vigorous exercise per week. So translated into English, that's about 30 minutes of exercise a day, 5 days a week, where you're sweating a bit, your heart's pumping a little bit, you're a little bit out of breath, but you can still talk to somebody. Vigorous exercise is when you can't talk to somebody, you can't carry on a conversation. Okay, and then they also recommend muscle strengthening activities 2 or more days a week. And this is not just for diabetes, this is also just to prevent falls and to prevent osteoporosis and so forth. But we also do know there's research that shows the amount of muscle mass you have actually also, increasing your muscle mass also improves your insulin sensitivity. So weightlifting is actually really a good idea for that reason as well. Any questions about these guidelines? So Google it, look it up to see all the details. It's pretty interesting stuff, I think. All right, and then there's a few other things. There's a little more research about not just the total calories that you're eating, but it appears that saturated fats, we've all heard this before, things that come primarily from animal source, so meat and dairy, seem to promote diabetes seem to decrease your insulin sensitivity if you eat a lot of red meat. Trans fat is the baddest fat around. Don't eat it. The good news is that companies are starting to take it out of their foods because nobody wants to eat this stuff because it's poisonous. That's a strong statement, but really it's not good. Where does trans fat come from? It's a man-made fat that people use, that companies use to produce packaged foods, particularly like baked goods. The old Oreo cookies, for example, had a lot of it, like that lovely, yummy white middle stuff. That's often trans fat, that kind of, that lovely creamy thing. So the good news is you can get, I don't know if Oreo cookies still has it. I know that Newman's Own doesn't. But look at your labels, okay? This is really important, not just for diabetes, but trans fat is really bad. It really seems to be a player in cardiovascular disease, so heart attacks and strokes too. So look at your food labels, and if it says hydrogenated oil, throw it away. Don't buy it. It's bad stuff. Okay. The other thing that causes trans fat is like frying in oil over and over again. Over time, that oil produces trans fat. So like McDonald's fries, if they don't change their oil frequently, they can make trans fat. I don't mean to single out McDonald's, but if you do home frying, change your oil frequently because otherwise you'll produce trans fat. And then a big one is sugar-sweetened beverages. By that I mean a lot of things. Sometimes people don't realize that they're drinking sugary beverages. Like I had a lot of people tell me, "Oh, I'm not drinking soda. I'm drinking green tea." Look at the ingredients on bottled green tea. It's got a lot of sugar in it. Okay, so in order to know you're not drinking sugar-sweetened beverages, if you look at the ingredients. If it says high fructose corn syrup or cane sugar, even if it's natural, is not a good idea. Yeah. They're a lot better. The problem with artificial sweeteners, it depends on how much you drink. They were tested, the safety of these sweeteners was tested at sort of a moderate consumption rate. So if you're drinking, and I have a lot of patients who drink this, like 2 liters of diet drinks a day, you might get into trouble. We don't really have good evidence that that's safe. But yeah, if you feel like you just have to have a sweet drink diet. They seem to be pretty safe. So far, we've had really relatively few problems with diet drinks that we know of. Yeah. And be careful. It's soda. It's a lot of the sports drinks. People think that if it's hot out, you're supposed to drink Gatorade. Please don't. There's a lot of sugar and salt in Gatorade. Okay. Unless you're really working out in the sun and sweating profusely and doing football practice, you don't need Gatorade. Okay. And then juice also. It doesn't matter if the sugar is natural or not. It's still sugar. Okay. So like a lot of people drink orange juice. That is loaded with sugar. Okay. And then so remember, there were two things that happen with diabetes type 2. The first thing is the insulin resistance, but then if you've had your sugar up high long enough, your pancreas starts getting damaged. We're only beginning to do research about, of course, the drug companies are all over this. They want to find a drug that'll protect your pancreas. There is the FDA has not actually approved a drug for the purpose of preventing diabetes yet, but that diabetes prevention trial that I told you about just a little while ago actually had an arm that was metformin, this drug, and it also reduced the risk, but not nearly as much as losing weight and exercising. But you may find some people may be put on metformin for pre-diabetes, and the way metformin works, and it seems to work better for younger people and for people who are really heavy, who have what we call morbid obesity, really high weight. And for people who've had gestational diabetes, meaning diabetes in pregnancy. Okay, it doesn't seem to work as well for older people and for people who are not quite as heavy. But it does work, it helps, but it's not the main way to prevent diabetes. And there's other medications that have been tried, but again, not approved by the FDA. And then the other really intriguing thing that's coming out is gastric bypass surgery. We don't understand exactly why. But even before, when people have gastric bypass surgery, even before they have weight loss, sometimes lose their diabetes. It's really baffling. It's fascinating. We really don't understand it. We think it has to do with these pancreatic beta cells for people who haven't gotten so bad that their pancreas is basically shot. People who haven't already gone on insulin. So that's pretty intriguing. And I used to be dead set against gastric bypass surgery because I figured we should all be able to do it with diet and exercise. But I'm starting to rethink it. I think that there probably is a place for this, particularly in people who are tipping towards diabetes. Okay, so then I'm sure you're all asking yourself, am I at risk? Okay, should I worry about this, or is this for my neighbor or my husband or wife or whatever? So I've included in your handouts this thing. This comes from the Centers for Disease Control, and it's a quiz that they have made to figure out if you are at risk for, and whether you need to ask your doctor to be screened. You may already have been screened. I will say, I don't want to disparage my colleagues, but a lot of people don't really understand how important prediabetes is. This is kind of emerging. So if you score high on this quiz, you might want to ask your doctor, do I have prediabetes? Because if I do, I want to do something about it. I want to prevent diabetes. Okay. So as you can see, if you're over 65, you already got a 9. Okay, that means you're already at risk. So everybody over, oops. Thank you. Thank you. Okay, so if you're over 65, you're at risk just by virtue of your age. So you should definitely have your blood sugar, either your blood sugar or your hemoglobin A1C checked every 3 years to make sure you don't develop diabetes. And then if you're intermediate age, you get a 5, so you're partway there. And again, these are the same risk factors that we've been talking about. Okay, so getting no exercise is just as much a risk factor as being a little bit older. Okay, if you're overweight, and that's the chart for this. This is kind of like the ideal body weight. This is if you're over 25, a BMI of 25.
Charts used to be gender specific. Is that?
This is not a great chart. I mean, this is just they had to fit it onto this little page. So you're right. If you can ask your physician what your BMI is, and if your BMI is 25, that gives you a 5. And then there is, like I said, the genetics. Somebody was asking me the relative importance of these things. This kind of gives you a sense of the relative importance of these different things. I've started with the most important ones, but having a parent or a sibling with diabetes is also a bit of a risk factor, not as much as the other things. And having had a large baby suggests you might have had gestational diabetes, diabetes of pregnancy, and that also is a little bit risk factor. But again, these are not nearly as important as these things being older and being overweight and being inactive. Any questions about that? No? Okay. And then here's the best news of all. If you do have prediabetes or you're at risk, you get a score of 9 or higher on that, you are welcome to do a good thing for your health, which is the diabetes prevention program. So I told you about the diabetes prevention trial. Because these results were so impressive, the Centers for Disease Control created a program called the Diabetes Prevention Program. And they have worked with institutions across the nation to try to get this program in our communities. And we have it here in Alamance County, and Rachel's part of this. She and I have been working hard together to get this here in Alamance County. So there's that's this thing, okay? The YMCA has partnered with the Centers for Disease Control to put this program in our communities. And so this is the Greensboro YMCA, but she's working with the Alamance YMCA. So if you do have prediabetes, you can call her number, and it's on your handouts here. Call her number. She would love to start a class in Alamance County. We're very close. I've been sending her people as quick as I can, and we've been trying to get other physicians to also send her folks. So we're very close to, you need at least 8 people in a class. This is a year-long program, and that sounds like that's a big commitment to do a whole year. It's weekly for 16 weeks, followed by monthly for the rest of the year. And you might ask, why do you need to go to that many classes? Well, it's what Rachel said. It's really hard. It's incredibly hard to change your lifestyle. We all know this, right? And it turns out that this kind of arrangement where you have group support and help each other figure things out over a stretch of time is the only way to do it. It's the only thing that really, really works. For most people, for most people. So that's why it lasts a year. And the other thing we know is that the more classes you go to, the more likely you are to both get to those goals that Rachel told you about and to keep with them, to not regain that weight and to stay physically active for the rest of your life. So it's worth the year-long program, but it's hard to commit to. For those people who aren't really sure they can actually commit to a whole year's program, there's the Lifestyle Center has this, they have a 2-hour class here in this, I think it's in this building. Right now it's every 2 months. They can make it more often if there's enough people interested in it. And they're so wonderful. They have a bunch of nurses and dietitians in this program who are just so great. And they teach that class. And they will encourage you to enroll in this if you go to that class, because we know that that's really what it takes to make a lasting effect on your lifestyle. And then just so you know, if you're not prepared to do that, there's also the Lifestyle Center has dietitians. You can go talk with them. Some insurances pay, most don't, unfortunately. Weight Watchers, I put that down there because there's a lot of research on Weight Watchers, and it works. Particularly, it's a similar philosophy to the diabetes prevention program, which is that it's a group support thing. You go in and you talk with people. I don't know if any of you have participated in Weight Watchers before, but it's very much about the group, and it's also about accountability, going in and weighing yourself, measuring your physical activity and all that stuff. So that's a really good thing. If you're overweight and you don't want to do this, you could do that. And then, of course, exercise is a key ingredient to success. And there's the Parks and Rec department. And for older folks, for seniors, the Coronado Senior Center has a whole bunch of wonderful activities to improve physical activity, to increase physical activity. Any questions about that stuff? No? All right, so in summary, there are 2 kinds of diabetes, type 1 and type 2. We've talked mostly about type 2, caused by a combination of insulin resistance. That's what happens first, and then subsequent damage to the pancreas. It takes a good 10 years to develop, which means that we have an opportunity to prevent it by losing weight if we're overweight, exercising more, and eating healthier.